My name is Dr. Hassan Tahir. I'm the interventional cardiologist at Lake Cumberland Hospital, and I have been a physician for the last 7 years. Since my childhood, the meticulously crafted, human body, especially the heart and its complex functioning, has always intrigued me and amazed me. Seeing the smile on the face of the patient once you treat them has always been the most gratifying thing for me. Because of my, knowing the body and, the thirst for understanding the human body led me to this important decision to choose medicine as my career. Nothing has, amazed me and, more than finding out that how, a dying patient, a cardiac arrest patient can be brought back to life with just, going through the percutaneous to the artery, into the heart arteries and opening up the artery. And seeing those patients the next day smiling and, talking to the family and eating food, that has always been so gratifying. Interventional cardiology can actually change the lives of the patients within hours. We are talking about, a dying patient and the next moment the patient is alive. So that has always been, intrigued me and amazed me. And there has been so much revolutionary changes in the last 5-6 years. So much has changed when it comes to intervention. We can replace valves, implant valves percutaneously without surgery, just under local anesthesia. We have new devices which can open up the the arteries which we could never think about opening just like 10 years ago, and we have devices now we can open that. But despite all of these revolutionary changes, still the coronary artery disease is the biggest cause of death in the whole world and the USA. So there's still a room to have more advancement, and I want to be a part of that advancement and want to contribute whatever I can to change the lives of the people who are at highest risk of dying. Me and my wife have always been a small town couple, so we have always enjoyed our stay in small towns. Throughout my residency, I did in a small town in Pennsylvania. For the last 4 years, we have been staying in South, initially for my fellowship in Alabama, then for interventional fellowship in Tennessee, and we were always had a very good time in the South, and in Knoxville, we found out there is a need for interventional cardiologists in Somerset, Lake Cumberland, and we were so close by, and we visited the town, and we really enjoyed the calmness and of the city, and this town being close to the bigger cities if you want to go. The philosophy, the most important part of the patient care is actually to consider the patients as your own friend or family. So I would always give the same kind of compassion, dedication, and commitment to the patient as I would give to anybody who is close to my heart. I think that's very important. I don't remember patients by room numbers. I remember them with their own names. I tend to talk to their families, even if they are not around, to come back and talk to them. It's very important to keep everybody, under the same loop. And it's also very important to communicate to the patient in their own language. Sometimes we talk about and we are in medical terms which might not be understanding for the patient. So it's very important to be at their shoes and see and teach them in the language they can understand.